Hey guys, this is Dr. Butler with Eye Care Center right here in Central Kentucky. If you're watching this video, chances are you are interested in some contact lenses. We're going to go over what kind of contacts do they make, how to get them in and out of your eye, and then finally how to take care of them and how to protect your eye. Let's get started. Contact lenses come in a variety of different options and are all given at what's called a wear schedule. A wear schedule is an FDA approved amount of time in which you can wear your contact lens. Contact lenses come in dailies, 2 weeks, and monthlies. A daily lens is designed to be used exactly how it sounds. You'll start the day with a fresh new lens, and at the end of the day, simply discard that lens into the trash. A 2-week or monthly lens is designed to be disinfected in a case while you sleep. You will use the same lens for either 2 weeks or a month, depending on which contact you have. At the end of your wear schedule cycle, you will throw that lens away and get a new lens. You'll then repeat this cycle throughout the year. All wear schedules have their own pros and cons, some of those including comfort, price, and health to your eye. Make sure you and your doctor discuss which mode of wear is right for you. It's also important to note that we will never recommend that you wear your lens past the FDA approved amount of time. Doing so greatly increases your risk for infection, complications, and poor comfort of the lens. Next, we'll go over how to get the lens into your eye. First thing is wash your hands thoroughly for at least 20 seconds. This ensures that no bacteria will make its way onto the contact lens. Make sure you dry your hands with a lint-free paper towel to ensure that microfibers from the paper towel don't get into the lens. Doing so could result in poor comfort and poor vision. You will then open the blister pack of your contact lens and place the lens on the index finger of your dominant hand. Before inserting the lens, you want to make sure that the lens is not inside out. Putting the lens inside out onto your eye can result in poor comfort and poor vision. A correctly placed lens will rest on your finger in the shape of a bowl. Make sure that the edges of the lens are flared in and not outward. If you have trouble seeing the edges, you can do what's called the taco test. Simply take the lens, put it between your index finger and your thumb, and pinch lightly. If the lens is on correctly, it should flare in like a taco shell, not outward. You also want to inspect your lens for any tears, damage, or defects. If you have a defected lens, make sure you throw it into the trash and get a new one. If you have astigmatism, you have an extra step. When you come in for your training, we will show you that astigmatism lenses have a small marking on the bottom of the lens. That marking needs to be inserted a certain way into your eye. Don't worry, if you forget that, we will remind you. So now it's time to insert your lens. Understand that you are not going to be touching your eye with your finger. Your finger is touching a contact lens, and the contact is touching your eye. These lenses are designed to be safe and comfortable for your eye. There are 2 main methods to start with when learning to insert a lens onto the eyeball. The first method is called corneal touch. This method involves placing a lens directly onto your eye while looking straight ahead. Start by sitting down in front of a mirror. Take your non-dominant hand and hold your top eyelid open firmly against that bony part right above your eye. Next, use your dominant middle finger to pull your lower lid down. Now you're ready to go. Simply bring your index finger with the contact slowly toward your cornea. When the lens touches, you may feel some small suction as the lens forms to the shape of your eye. Go ahead and blink a few times and boom, you are wearing your first contact lens. Don't be discouraged if this takes you multiple tries. The second method of inserting a contact is called scleral touch. The sclera is that little white part of your eye right below the colored part. In this technique, You will be placing the contact lens onto the sclera and then allowing the contact to gently glide onto the cornea. Simply pull the lower eyelid down, look all the way up, and use your index finger to place the contact directly onto the white part of your eye. Look all the way down into the lens. Look left, right, and allow the lens to find its home. Blink a few times and boom, you are wearing a contact. After mastering insertion of the lens, guess what? It's time to take it back out. Before attempting, again, make sure your hands are nice and clean. The easiest way to remove a lens is to use one hand, pull the lower eyelid down with your middle finger. Touch the lower part of the contact, then drag the lens down with your index finger. At this point, the lens is sliding off the cornea and will be easier and safer to remove. Simply use two fingers, your index and thumb, and lightly pinch the lens, then remove it. If you're having trouble with that, another method is to take your non-dominant hand, hold your top eyelid open, and then use your dominant middle finger to pull your lower lid down. Then simply use your thumb and finger to pinch the lens from the bottom while looking still straight ahead. After removal, you will put your lens back in its blister case and try a few more times until you get a fluid, smooth motion. The most important part about contact lenses is hygiene and maintenance. When done right, contacts are a safe and effective way to make sure that you are seeing your best. When done incorrectly, you can cause scarring, vision loss, and poor comfort to the eye. Some of these things are not reversible, which is why you want to be crystal clear on how to clean your contact lens. Rule number 1 is to never sleep in your contact lenses. While it may be tempting, having a contact on your eye while your eyes are closed and sleeping creates an environment for bacteria and little bugs to grow. These bacteria can cause infections, which we call ulcers. Ulcers are no fun. Now, there are some lenses FDA approved to be slept in for an extended period of time. If you are interested in that, please ask your doctor at your training appointment. Daily lenses are by far the easiest to take care of and maintain because you will take this lens out at the end of the day and throw it away. The biggest pointers with a daily lens are to make sure your hands are clean and to never reuse the lens. This eliminates the need to have to clean the lens. For all other lenses, including 2-week and monthly lenses, you will want to make sure that the lens is properly cleaned and in good condition the entire time that you wear it. First time you open the lens, it will come in a blister pack. You will wear this lens, and at the end of the day, you will want to clean and disinfect the lens before using it the next day. Before removing the lens, you'll want to grab your contact lens solution. There are different types of contact lens solution, and we will recommend a solution that's right for you personally. First, remove your contact lens. Before placing it into the case, you will place in the palm of your hand, sprinkle a tiny bit of solution onto the lens, and rub gently for 20 seconds. Then rinse each side of the lens briefly for about 10 seconds. After this, place the lenses in the case. You will then fill the case with solution and make sure the lens is completely submerged in the case. The solution will need to take time to disinfect the lens. Most solutions recommend an average of 6 hours while you're sleeping to disinfect the lens. Each solution is different and you'll need to become familiar with your own solution. When you wake up in the morning, you will simply open the case and insert your lens. Dump the excess solution in the case down the sink. Allow the case to air dry in a clean, dry environment throughout the day. With your 2-week and monthly wear lenses, at the end of your wear cycle, you will just throw them in the trash, get a new lens, and repeat the same process. It's important to note you'll actually need to clean your contact lens case as well. This can be done roughly about once a week. Simply use the same solution, open the case, and then clean the case with your finger, again, about once a week. These cases will also need to be replaced periodically. Luckily, when you buy Solution, a case usually comes with that. Most solutions will follow this routine. However, there are some alternatives such as ClearCare, which uses hydrogen peroxide and a cleaning cage. If this option is right for you, we will discuss this at your follow-up appointment. Congrats! You are now a contact lens expert. After trying your lens, your doctor will see you back for a follow-up appointment to make sure that your lenses were comfy and worked for you throughout the week. Make sure to show up to that appointment wearing your contact lenses, unless they're uncomfortable or giving you bad vision. We will see you soon.